Hi, I'm Kevin Luters with Bell Medical, and I'm excited to introduce the LifeFlow Rapid Infuser and the fact that the LifeFlow has been approved for use with the Warrior. So first of all, we're going to talk a little bit about what the LifeFlow is, and then talk about what makes the Warrior the only blood and fluid warmer to be able to be approved by 410 Medical, the manufacturers of the LifeFlow device. So first of all, what is LifeFlow? LifeFlow is a rapid infusing system that every time I pull the trigger, I'm able to deliver 10 mLs of fluid. And the way it works, it's kind of based on the principle of the pull-push, where you're opening up the stopcock, pulling in fluid, and then you're closing the stopcock and then delivering fluid to the patient. So the problem with that method, though, is a lot of times the shaft of the syringe is touched, and that can contaminate the shaft and then deliver germs and bacteria into the bloodstream of a patient. So basically the disposable on the LifeFlow is the actual infusion gun here and this system here. It is used for blood and for fluid, and it has a spike system that can be spiked into a fluid bag or into blood and fluid. So basically, to load the LifeFlow, you simply numbers up, put the system in, and then you close the lid, and now you're ready to prime the system. So basically, once again, each time I pull the trigger, I'm delivering 10 mLs of fluid. I can actually deliver up to 500 mLs of blood or fluid in less than 2 minutes. This system is actually 4 times faster than a pressure bag pumped up to 300 millimeters of mercury. So the LifeFlow can deliver fluids rapidly, but yet in a controlled manner. So it truly is a life-saving device. Now, why is the Warrior the only blood warmer that has been approved by 410 Medical and the LifeFlow? Well, the reason is because the Warrior is a smart warmer. It actually uses a stainless steel coil disposable. So this is the disposable unit. This is a demonstration model. Yours would not open up, but basically this stainless steel coil has sensors on it, and the device will actually monitor the flow rate and the temperature going into the system hundreds of times a second. So it's truly a smart warmer. So as you're infusing the fluid via the trigger system, there's great pulsations in the flow rate. The Warrior is capable of monitoring those and adjusting the current to this stainless steel coil. As a result, we're always delivering 38 degrees C. The Warrior itself has the ability of delivering 38 degrees C even at 290 mLs per minute of flow rate. And that's on 5 C temperature fluids. If the fluids are warm, we can actually deliver up to 500 mLs per minute. So the Warrior truly has the capability of delivering both keep vein open flows that warm a patient, but also if you have to deliver flows rapidly, whether it be with a pressure bag or some other kind of infuser or the LifeFlow device, the Warrior can handle it. So let's demonstrate that together. I'm going to put this demonstration system down, and I'm going to connect the LifeFlow to the Warrior. So basically, there's only one way to connect it. And what's nice about the Warrior system is basically all the heating is done within 18 inches of the patient. So I have my Warrior here, and I'm going to turn on the Warrior. Well, first of all, I'm going to prime it. And the way you would prime the Warrior is I would basically have it connected. I'm going to pull the trigger, and there's 1 pull and 2 pulls, and now I'm pretty well primed the system, basically. Okay, so now I'm ready to go. I turn on the system, and it will go through an initialization, which takes 3 to 5 seconds, and once that's completed, it starts the warming device of our disposable. So now what I'm able to do is basically I'm having my finger on it and I feel it. I'm delivering 10 cc's. I already feel it getting warm, and now at 20 cc's and within less than 7 to 8 seconds, I'm delivering warm fluids. And what I have up here is fluid bags filled with water and ice. So we're delivering fluids, and what the Warrior does, it actually tells me right now I'm delivering, inputting temperature is 15 C and output is 38 C. If I continue to pull on it, I'm going to get the colder fluid in, and now it's down to 14 C incoming fluid, and 38 outcoming. Now it's down to 10 cc's, 10 C incoming and still 38 out. So no matter what the flow rate, the Warrior can handle the flow rate. And the LifeFlow is truly a life delivering infusion device. In conjunction with the Warrior, it helps maintain normal thermia with your patient. What's also unique about the Warrior is I have the ability of opening the Warrior up, and I can now take this part, which is the brains of the Warrior, out and add a battery to it, and now I can transport with this patient, so I can go up to X-ray and all the time be warming the fluids. I can go to the trauma suite, I can go to the OR, I can go to ICU, and the entire time I'm transporting, I can transport with the Warrior delivering warm fluids, whether I'm using the LifeFlow or just gravity to infuse those fluids. So the Warrior has some unique capabilities that can be used throughout the hospital, and that is kind of in conjunction with the LifeFlow. So there we have a unique partnership with 410 Medical's LifeFlow Rapid Infuser that gives you controlled yet rapid infusion and the ability to warm those infusions with the Warrior from Q&Flow. Both devices aid you in saving lives and delivering warm fluids. Thank you, and please contact Bell Medical with regards to the LifeFlow and the Warrior blood and fluid warmer. Thank you.